You're watching Good Day Tampa Bay.
State of coronavirus here in the Bay Area is constantly evolving as cases fluctuate and doctors learn more about it. Let's get to our old friend, Dr. Jason Wilson. He's at Tampa General Hospital over on Davis Islands this morning. Hey, Doc, good morning. How you guys doing over there?
Hey, great to hear from you again. We're in a steady state right now. You know, if you remember, we kind of divided the virus, this pandemic, up into two phases: middle of June and then post middle of June. And middle of June is when we saw that big surge of people coming to be tested. That really became this big issue in the hospital around the beginning of July. So that first couple of weeks of July, we were constantly having to recreate new capacity in the hospital, get more space for people. And now it seems like we are stuck. We're not having to build for new capacity. We're not accelerating upwards anymore. We're just sort of heading upwards. You know, we kind of went up to about 52 cases per 100,000 in this whole area that first week of July. And one slimmer of good news is the past 2 weeks, we've seen a decline in those number of cases. Having said that, though, we're still 20 to 30 times higher than the number of cases we had when you go back to March, April, and May.
Okay, then I have to ask this question. Are you encouraged?
I think the mask mandate and I think that the bar closures are showing effect. And so I'm encouraged that we know the public health interventions work, and I'm encouraged the public is helping us out. That's really what we need at the hospital.
Good.
And so I'm encouraged we've seen 2 weeks of steady decline, but the concern I have is that if we plateau way up here, where we really need to be is way down here. So if we're going to get stuck on a flat line somewhere, it's got to be here, not here. So we still have to take this flat line and bend it. But in terms of patient safety and keeping our hospital safe, that is encouraging because we at least know what to expect every day and aren't seeing an increased surge of patients on top of what we already have.
Look at you doing graphics with your hands on a Zoom call. You must have done this a few times. That's great. Hey,
I'm going to become the weatherman next.
Well, maybe. And you don't want that right now. Hey, I want to ask you about something you brought up last week, and a lot of people got really interested in it around here, and that's the convalescent plasma. You were encouraging people to donate their convalescent plasma if they have had the virus and recovered. What is the process? I mean, obviously, if you've been diagnosed, you know you've had it. But what if you're not sure you've had it and you may want to donate some plasma? What's your recommendation on that?
Yeah, the best thing is to go to the OneBlood website or to call OneBlood. And there is some just general information about plasma donation. Basically, about 14 days after you have symptoms, you become eligible to donate. And now, if you're not sure you have it, they'll probably do an antibody test, which will help them understand if you did have the virus or not. And if you have antibodies in the blood, they will allow the donation of plasma and get it to somebody that saved their life.
There's been talk that the antibodies don't last in a person. So is it important if you're going to do this to do it sooner than later?
Yeah, a lot of unknowns around immunity and how we respond to this virus. There's two types of immunity. There's both antibody-driven immunity and also a whole nother cell system, T cells and things like that, that also drive immunity. And, viruses can be fought by both systems. We've concentrated a lot on the antibody part of things because we can measure antibodies easily, and we might be able to use antibodies for treatment. And so that's why we've heard about antibodies a lot. So far, it looks like people who get sicker with this virus have a higher antibody response. We're a little concerned because we said antibody response start to go down after about 3 months. It doesn't tend to go to zero, but it does start to decline. Certainly, the sooner in that acute phase that you were to donate plasma after you've recovered, probably the more antibody you would have, and potentially the more useful that plasma could be.
Doctor, thank you. Dr. Jason Wilson over at TGH. We love you guys. Thank you for all you're doing, and let us know if we can help, okay?
Yeah, keep telling people to donate plasma. It really does help, and keep wearing your mask. I think we are seeing some effect of that.
Nice to hear that. Nice to hear that. Take care, okay?
Thank you very much for having me. Take care, Russell.
He just offered to be a weatherman. I don't know if you heard
is he
that.
still on? Does he want to do it?
I mean, I think he's a little busy right now, but just in case you need some help, you got a doctor, you got a medical doctor offering. I bet he learns. I bet he learns fast.
Honestly,
I bet he learns quick.
You know how he's like, He's like, I'd love to learn weather. I have absolutely no desire to be a doctor.
Well,
so
not today.
That's a tough. Listen to me. Tough. And we thank every single one of them for what they are doing for us every day, especially right now too. So.